Hi everyone and welcome back. So today's exercise I want to go over is the functional squat. Now most of you might know the functional squat either as a deep squat, a toddler squat, or even the grok squat. Now with this specific movement, what it helps to do is actually stretch out all the muscles of the pelvis and the lower legs, more of a dynamic stretch than your traditional static stretches, but it also helps to keep the joints more mobile and flexible. So from the pelvis and hips all the way down to the knees and the ankles. This exercise used to be done as a standard daily routine or daily procedure many years ago. So you would sit in that position going to the toilet, you would sit eating that way, you would sit that way looking at animal tracks, so when you're hunting, tracking animals. This was just a standard everyday procedure, so there was no need to put time aside to actually do exercise or do a functional squat. But nowadays, because we sit everywhere, so whether we're driving, sitting at an office desk, in an office chair, sitting relaxing at a lounge chair, so when we sit down on anything that is not a deep functional squat, so on a couch or on a chair, your glutes become inactive, they don't work anymore. And research studies have actually indicated that after 15 minutes of sitting down, that neural pathway to your brain actually shuts down. So it's very important that we actually address the glute and the core strength issue, so the weakness or lack of activation, before we can do anything else. So this is one of the most common exercises besides the pelvic tilt that I went over last week that I would introduce my patients with. This is a very good exercise to improve mobility and flexibility if you do have any lower limb issues or any discomfort or even arthritis. I had an 81-year-old patient who had severe osteoarthritis of both knees. She really struggled to climb stairs, up or down was both a problem. But after about a month of doing this specific exercise once a day, only for 30 seconds, it actually alleviated all that discomfort and she was able to climb stairs without any difficulty. So this is a very basic exercise, one of the most primal movements that there are out of the 7 primal movements. So in order to start, obviously you need to progress slowly. Just do what you're capable of, and make sure that you always have something to hold on to. Because of our postural change and our center of gravity that shifts, usually when you squat down with your bum that low, trying to keep everything as mobile and flexible as possible, your center of gravity is going to try and push you backwards. So you might feel like you want to fall over backwards, and that's just because of that center of gravity not being adequate. So you can hold on to a pole or a tree, you can hold on to the underside of a ute or vehicle. Anything will suffice just to be able to support your weight, because in the beginning, to drop that low down to get into that correct position, you are going to want to fall backwards until you do it repetitively enough, frequently enough, and strengthen the anterior or the frontal side of the muscles. So you want to work on the shin muscles, the flexibility in the Achilles and the calf, because they counteract each other. But until then, simply just getting down in that position is going to provide flexibility and mobility to the lower limb joints, and start with that rebalancing of the muscles. So I've even found lately just using a kettlebell, so I use an 8 kg kettlebell just to hold that stability, which I'll demonstrate a few of those as well. So what you want to do is try and get down in the position so that you don't really utilize the quad muscles. When you use the quad muscles in a traditional squat as an exercise, it actually shortens the quad, it pulls on the patella, and that can cause compression on the knee joint, causing pain or more inflammation, which you want to avoid. So dropping down into that position, just having the glutes and your postural muscles working, takes off the strain from the knees, and that's why people with osteoarthritis or knee issues can actually do the squat as well. You want to stand about shoulder width or hip width apart, so your bum should be able to fit between your heels, and your feet could slightly be tilted out, but you don't want to stand like a duck with your feet completely out. The more flexible you get, the more you'll be able to turn your feet facing straight forward. So once you're into that position, you've got something to hold on to. You want to try and tilt the pelvis, so just straightening up your spine as much as possible and pull the shoulders back. What you want to avoid is sitting forward in this position once you're in that squat, because we want to try and improve that muscular balance. You want to activate the postural muscle, so get the shoulder blades back and get the head up. You don't want to be looking forward or looking down, which is going to aggravate your straightening of your neck curvature or worsening in your forward head carriage posture. So when you do this, so I'm going to demonstrate. So you are going to stand, like I said, just further than hip width apart, tilting your feet out. You might not be able to see my feet specifically, but just tilting your feet out ever so slightly. And for stability in the beginning, that front and back stability, you can hold your hands out to the front. You want to squat down all the way. Then you can insert your knees, your elbows between your knees, and even further push open the knees. So you don't want to be doing that with, or even one side with a knee collapsing inwards, because that knee collapsing inwards is indicating a weak glute. So you really want to force the knees open, squeeze the buttock together, and then you want to try and get the shoulders back in that position. So what I generally do, especially if I feel a little bit stiff on a particular day, I have got my kettlebell. I drop down into the position, put my elbows between my knees, push the knees open, and then pull the shoulder blades back and get the head up. You can hold it low down, doesn't matter, as long as you're pulling those shoulders down and squeezing the buttocks. When you're squeezing the buttocks, you'll see the knees actually open up. And then in that position, when you're done after counting to 30, you can squeeze the buttock again and stand up in that position again. You can do it as an exercise as well. So to lift something, just remember to keep those shoulders back and squeezing up every time. Nice, slow, controlled movements, and dropping down again. What we don't want to see is as you come down, the knee doing that, because that is going to cause instability in your pelvis. Right, so like I said, you can hold on to anything at all, doesn't matter, as long as it's something heavy enough to actually support your weight. So easiest in the morning or in the evenings, just drop down into the position, reset the posture, get your head in the corrected position, count to 30, squeeze the buttock and get up. And it's as simple as that. Doing that repetitively, frequently, and consistently enough, you will start strengthening the correct muscles, so the front of the leg, especially the shins, and you will start stretching out all the correct muscles so that you can start maintaining that without having to hold on. Give yourself about 2 to 3 months if you're unfamiliar with a squat, because that is how long it can take to actually stretch those ligaments and muscles correctly. Tune in next week and have a great day.